Welcome to an animation on visual fields, part 2 of DIY eye exams. Visual field testing is an important and regular part of eye care. It assesses peripheral vision, a function of the second cranial nerve, the optic nerve. It also picks up any problems in the rest of our visual pathway. The simplest way to perform a visual field examination is with a confrontation visual field exam. This is often used as a screening tool and assesses if there are any obvious visual field defects in any of the 4 quadrants of each eye. To do this, we compare our hopefully normal visual fields with the patient's. The positioning of yourself and the patient is integral to a reliable exam. Face the patient with your eyes at the same level. Additionally, ensure you are around 1 meter from your patient. As we test each eye individually, ask the patient to cover one eye with their hand. Likewise, cover your own opposing eye. For example, if the patient covers their right eye, you should cover your left eye, mirroring what they are doing. Ask the patient to focus on your eye and to not move their head. Now, to test each quadrant, flash up briefly a random number of fingers in each quadrant and ask the patient to report the number. Ensure that your hand is equidistant from yourself and the patient. Now, if they are unable to see your fingers or if they incorrectly guess, an abnormal visual field is suspected. If any defects are found, these can be more accurately assessed using a computerized field test. This test displays a series of small dim lights in a machine. The patient must respond every time they can see a light. Then, the computer prints out a map of the patient's vision. Here we have an example of a normal visual field. And here's an example of an abnormal visual field. To understand and interpret our confrontational visual field results, we need to first understand the visual pathway. That's a pathway from our eye all the way to our brain. In the eye, images are inverted upside down and flipped left to right. This means that the left side of the retina perceives the images in the right field, and vice versa. The retina sends all its signals through fibers that converge at the optic nerve. Left and right optic nerves then converge at the optic chiasm. Here, fibers from the nasal, otherwise known as medial aspect, of each retina cross over and decussate to the opposite contralateral optic tract. Fibers from the temporal retina remain on their respective sides. As these fibers travel in the optic tract, left-sided fibers correspond to the right visual field, and vice versa. From here, the optic tract synapse at the lateral geniculate nucleus, otherwise known as LGN, before the optic radiations travel to the visual cortex in the occipital lobe. Therefore, lesions at different components of the visual pathway correspond to specific visual field defects. Let's have a look at a few of them. This lesion is in the right optic nerve. It is pre-chiasmic as it is before the optic chiasm. This will result in total right eye vision loss. Now, if there is a chiasmic lesion, such as a pituitary adenoma that compresses the middle of the optic chiasm, nasal fibers from both eyes will be affected. Remember that the nasal retina is responsible for the temporal visual field. Therefore, this patient will suffer from temporal vision loss in both eyes. This is otherwise known as bitemporal hemianopia. Now it's your turn. Using your knowledge of the visual pathway, what will the visual defects for this lesion look like? Pause the video here and draw the defects before you continue. How did you go? If the lesion is post-chiasmic, such as a middle cerebral artery stroke affecting the optic tract, information from both eyes will be affected. In this case, the right optic tract has been affected, including nasal fibers from the left eye and temporal fibers from the right eye. This corresponds to a visual field defect in both eyes on the contralateral side, in this case, the left side. This is called homonymous hemianopia. Homonymous just means on the same side. In summary, confrontation visual fields tests peripheral vision in 4 quadrants. The visual pathway consists of the optic nerve, optic chiasm, optic tract, lateral geniculate nucleus, optic radiation, and visual cortex. A prechiasmic lesion will cause ipsilateral monocular blindness. A chiasmic lesion will often cause bitemporal hemianopia, and a post-chiasmic lesion will often cause homonymous hemianopia on the opposite side. I hope this video helped. Thanks for watching DIY eye exams.